Hi everyone. I want to talk today about Medicaid expansion in Georgia. As you may know, the Affordable Care Act did a lot of things. One of the things was setting up the online marketplaces where individuals can buy health insurance, sometimes with subsidies. Another thing that the ACA, Obamacare, did was expand Medicaid. But in a 2012 Supreme Court case, it's called NFIB versus Sebelius, the U.S. Supreme Court held that states don't have to accept Medicaid expansion. Medicaid is administered by states, but the funding for it comes from the federal government. So Georgia is one of the 18 remaining states that have not accepted Medicaid expansion. Most states have taken it, but not Georgia. What that has created is a coverage gap. And what that means is there are some people who fall into a gap because they make too much money to qualify for Medicaid, but they don't make enough money to qualify for subsidies under the ACA. You have to make a certain amount of money before you can get subsidies to buy your own insurance through the ACA websites. So that's the coverage gap. And right now, a lot of Georgians fall into that gap. I'll get into some of the numbers a little later. Georgia has not taken Medicaid expansion, and that means Georgia is turning down every year about $3 billion from the federal government. That's a big number. The whole budget of the state of Georgia is about $26 billion a year. So that would be more than a 10% increase in Georgia's budget if we started taking federal Medicaid money. Now, I want to be clear about this. It's a little confusing, but we've opted out of receiving the Medicaid benefits, but we have not opted out of paying taxes that go to fund those benefits. In other words, you get to opt out of the benefits, but we did not get the option of opting out of paying the taxes. And what that effectively means is money from Georgia's taxes is effectively going to other states like California and New York that have accepted Medicaid expansion. They're taking the expansion and paying the taxes. We're not taking the expansion, but we're still paying the taxes. Now, to be clear about this, if we want to get this $3 billion a year, we do have to put something into the system too. The state has to put up, beginning in a year or two, the state has to start putting up about 10% of what the federal government puts up. It's a 90-10 split. But still, the money is overwhelmingly coming from the federal government out of our taxes that we're just turning down right now. Why are we turning it down? People ask. Well, there's really no good explanation other than Republicans did not want a program with President Obama's name on it to succeed. They wanted Obamacare to fail, and refusing Medicaid expansion is really undermining the ACA. One of the things that has happened in Georgia, partially at least as a result of this, is 8 hospitals have closed since 2010 because a lot of hospitals are having trouble making ends meet without the money that would come from people in that coverage gap. It's not just hospitals. Doctors and other medical providers are struggling to provide services that they would otherwise be able to provide if we had that extra Medicaid expansion money. The latest estimate that I've seen says if Georgia started taking Medicaid expansion, 473,000 currently uninsured Georgians would start getting coverage. That is a big number. And we're passing it up every year because Republicans decided they wanted Obamacare to fail. An example of another state that has started taking Medicaid expansion is Louisiana. Now, that's not exactly a blue state. That is a very conservative state, but they're taking Medicaid expansion while Georgia is not. And their experience has been very successful. So 19,000 new jobs have been created in Louisiana since they started accepting Medicaid expansion as a result of the expansion. And Louisiana found that they actually ended up saving money. Even though they're going to have to start putting money into the system, what Louisiana and a bunch of other states have found is that they actually save more than they have to spend because, for all sorts of reasons, just one of which is this economic stimulus. You start making more taxes, you start having other ways for doctors and hospitals to make their ends meet, and the state ends up saving money. So I think Medicaid expansion is an unambiguous good for the state of Georgia. We ought to start taking it as soon as we can. It'd be a high priority for me as a Georgia State Senator. Thanks for listening.